Good day. We are the group 4 and we will going to discuss about renal disorders and common infections, its etiology, risk factors, clinical manifestations, management, pathophysiology and midwifery role. I am Lovely Subia from BSM 2B. I will discuss to you the first topic of our report. Renal disorders and common infections, Rubella and Influenza. Content outline, definition, etiology and risk factors. Second, clinical manifestations, the signs or objectives, and symptoms or subjectives. And next, pathophysiology. Next, management, the medical and surgical. And lastly, midwifery role or independent, dependent, and collaborative. Renal disorders. So, what is renal disorders? It is a condition in which one or both of the kidneys can no longer work on their own, which is the kidneys stop working and are not able to remove waste and extra water from the blood or keep body chemicals in balance. This condition is also called renal failure. Treatments for kidney failure include dialysis and kidney transplant. The treatment of renal disorders is the dialysis and kidney transplant. Next, introductions. The etiology of our topic. The two leading causes of kidney failure, also called end-stage kidney disease or ESRD, are diabetes, also called type 2 or adult onset diabetes, and high blood pressure. When these two diseases are controlled by treatment, the associated kidney disease can often be prevented or slowed down. The diabetes and high blood pressure, which are responsible for up to 2/3 of the cases. Diabetes happens when your blood sugar is too high, causing damage to many organs in your body, including the kidneys and heart, as well as blood vessels, nerves, and eyes. And I will discuss next the risk factors. CKD risk factors or chronic kidney disease risk factors. The gender, ethnicity, genetic component, low birth weight, urinary tract infections, oxidative stress, autoimmune diseases, obesity, dyslipidemia, diabetes, hyperuricemia, drug toxicity, hypertension, and age. At the age of 60 increases your risk for kidney diseases. As you get older, your kidneys naturally do not work as well as when you were younger. People aged 60 or older are also more likely to have diabetes and high blood pressure, the two leading causes of kidney failure.
I am Elsie Tagapan and I will discuss the clinical manifestations of renal disorders. Signs or objectives. You're more tired, have less energy, or having trouble concentrating. A severe decrease in kidney function can lead to a buildup of toxins and impurities in the blood. You're having trouble sleeping. When the kidney are not filtering properly, toxins stay in the blood rather than leaving the body through the urine, and this can make it difficult to sleep. Have dry and itchy skin. Dry and itchy skin can be a sign of a mineral and bone disease that often accompanies advanced kidney disease. You feel the need to urinate more often. When the kidney filters are damaged, it can cause an increase in the urge to urinate. You see blood in your urine. When the kidneys filter have been damaged, the blood cells can start to leak out into the urine. Urine is foamy. Excessive bubbles in the urine, especially those that require you to flush several times before they go away, indicate protein in the urine. Experiencing persistent puffiness around your eyes. The puffiness around your eyes can be due to the fact that your kidneys are leaking a large amount of protein in the urine rather than keeping it in the body. Ankles and feet are swollen. Decreased kidney function can lead to the sodium retention, causing swelling in your feet and ankles. Poor appetite. This is a very general sign, but a buildup of toxic resulting from reduced kidney function can be one of the causes, and also muscle cramping. There are also symptoms or subjectives like a reduced amount of urine, swelling of your legs and ankles, unexplained shortness of breath, excessive drowsiness or fatigue, persistent nausea, confusion, pain or pressure in your chest, seizures, and coma. The pathophysiology of renal disorder. Renal failure is caused by a progressive decline in all kidney functions, ending with terminal kidney damage. During this time, there is modulation and adaptation in still functional glomeruli, which keeps the kidney functioning normally for as long as possible. The remaining glomeruli therefore experience a rise in pressure through hyperfiltration. There are four phases of renal failure. First is the reduction in excretory function. Breakdown occurs when the remaining glomeruli are confronted by surplus of waste products, leading to osmotic diuresis. Second is the reduction in excretory renal function. Because the kidney plays a part in the regulation of many important hormonal cycles, renal failure also has endocrine consequences. Third, overhydration and a disruption of electrolyte balance. As long as the glomeruli can manage compensate, diuresis and fractional sodium arise. If the glomerular filtration rate noticeably drops, then the ability to compensate is exhausted, leading to increased retention of water and electrolytes. Last is the toxic organ damage as a result of retention of urinary excreted metabolites. Toxic organ damage can be explained under the umbrella term uremic syndrome. The rise in urinary excreted metabolites in the blood is called azotemia.
Hi, good morning. I'm Eloisa Sumalag, BSN2B, and I will report the management of renal disorder, influenza, and rubella. So I will start with the renal disorder management. So when we are talking about renal disorder, this is all about our kidneys. And the only treatments for renal disorder is through dialysis and kidney transplant. So let's start with the medical management. Getting dialysis and kidney transplant is the decision of the patient or the client, if she or she wanted to have it or not. And also considered and respect the decision of the family or the relatives of this patient before doing your part as a healthcare provider. Because without doing dialysis or having a kidney transplant is called medical management. It is really important to understand that supportive care and treatment to manage symptoms are not treatments for kidney failure and will not keep you alive. These treatments will help you live as comfortably as possible until your body can no longer function. So the decision making is really important at this part to both patient and to the family. So now let's move on to the surgical management of renal disorder. This is a kidney transplant. Kidney transplant is a surgical procedure to place a healthy kidney from a live or deceased donor into a person whose kidneys are no longer function properly. A kidney transplant is often the treatment of choice for end-stage renal disease compared with a lifetime on dialysis. So at this stage is a choice to end the disease or not, compared to medical treatment that a lifetime. because getting a kidney transplant have a advantage and disadvantage. So the advantage and disadvantage is whether you live or whether you survive or not. So make decision.
I am Anjali Sihalbo. I am discussing the midwifery role. Independent, offer advice and care for women with kidney disorder who are pregnant or planning a pregnancy. Pregnant women who have kidney disorder is at risk, especially to the fetal complications like as preterm birth and pregnancy loss. Midwife must give advices to the patient regarding renal or kidney disorders. Also for the women who's planning to have a pregnancy who have a kidney disorder, midwife must explain to her the complications or the risk of kidney disorder in pregnancy for her to be informed about it and for her to know what to do.
Dependent. Performs a physical exam checking for signs of problems with your heart or blood vessels, and conducts a neurological exam for kidney disease diagnosis. You might also need certain tests and procedures to determine how severe your kidney disease is. Tests might include: for blood tests, kidney function tests look for the level of waste products such as creatinine and urea in your blood. For urine tests, analyzing a sample of your urine can reveal abnormalities. For imaging tests, your doctor might use ultrasound to assess your kidney structure and size. For removing a sample of kidney tissue for testing, your doctor might recommend a kidney biopsy, which involves removing a sample of kidney tissue.
Collaborative or the referral, GP care only, GP care plus, specialist review, specialist care, telephone review and computer review. Midwife can't diagnose or can treat kidney disorder patient. So whoever pregnant patient who have kidney disorder must needed to be referred to a specialist for the prompt treatment to avoid high complications to the pregnant woman and to the fetus. It is also important that the patient will refer to a specialist for appropriate management and for general or specialist care in order to slow disease progression.
I am Lovely Suvia from BSM2B, and I will discuss to you the common infections of rubella. So ano nga ba itong rubella? Rubella is a contagious disease caused by a virus. Most people who get rubella usually have a mild illness with symptoms that can include a low-grade fever, sore throat, and a rash that starts on the face and spread to the rest of the body. Rubella is also called German measles. Is an infection that causes mild flu-like symptoms and a rash. Up to half of people infected with rubella don't have any symptoms and may not even know they're infected but still spread it to other people. Introductions. The etiology of rubella. Rubella is caused by a virus that's passed from person to person. It can spread when an infected person coughs or sneezes. It can also spread by direct contact with an infected person's respiratory secretions such as mucus. It can also be passed on from pregnant women to their unborn children via the bloodstream. Next, the risk factors of rubella. First, contact with infected patients, and also failure to get vaccinated, and lastly, overcrowding.
I am Elsie Tagapan, and I will discuss the clinical manifestations of rubella. There are signs or objectives: enlarged, tender lymph nodes at the base of the skull, the back of the neck, and behind the ears. Usually, if the lymph nodes become swollen or tender, it means that the person has some kind of infection. A fine pink rash that begins on the face and quickly spreads to the trunk and then the arms, legs before disappearing in the same sequence. We all know that the rubella is a contagious viral infection that is best known by its distinctive red rash. We also have the symptoms or subjectives like headache, stuffy or runny nose, and also aching joints. The pathophysiology of rubella. Rubella virus transmitted via respiratory droplets that infect cells in the upper respiratory tract, and also virus multiplies up to the virus can be found in the skin, blood, and respiratory tract. Rubella virus enters via inhalation, infects cells of the respiratory tract. It is spread via lymph nodes to the blood vessels where it induces an immune response which leads to lasting immunity.
So next is the medical management of rubella. There is no treatment for measles. Once a person is infected, the virus must run its course, usually 10 up to 14 days. Bed rest, acetaminophen, and other medication are often recommended or given to help treat symptoms. But if you contract rubella while you're pregnant, discuss the risk to your baby with your doctor. If you wish to continue your pregnancy, you may be given antibodies called hyperimmune globulin that can be fight off the infection. This can reduce your symptoms but doesn't eliminate the possibility of your baby developing congenital rubella syndrome. Just bed rest and acetaminophen for relief from fever and acne are the simple self-care measures that are required when a child or adult is infected with the virus that causes rubella. Now the surgical management of rubella. Based on the research, surgical care is not indicated because there is no treatment in rubella.
Good afternoon, ma'am. My name is Jovelyn Tisolito. I present the midwifery role. Independent. Educating parents about the disease risks to prevent future outbreaks of the virus. Dependent. Doctors confirm rubella with the help of laboratory tests. Doctors often recommend isolation from others, especially pregnant women, during the infectious period. Collaborative. No treatment will shorten the course of rubella infection, and symptoms don't usually need to be treated because they're often mild, but for those children who have multiple complications may require early treatment from a team of specialists.
I am Lovely Subia from BSM2B, and I will discuss to you the common infections of influenza. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but it's not the same as stomach flu, viruses that causes diarrhea and vomiting. For most people, the flu resolves on its own. The etiology of influenza. Influenza is caused by infections of the respiratory tract with influenza viruses, RNA viruses of the orthopixovirus genus, and influenza viruses are classified into 4 types: A, B, C, and D. Only virus types A and B commonly cause illness in humans. Next, the risk factors of influenza. First, chronic lung diseases such as asthma, COPD, bronchitis, or cystic fibrosis. Next, heart disease and chronic kidney disease. And fourth, diabetes or other chronic metabolic disorder, morbid obesity, severe anemia, including sickle cell anemia. Diseases, which is the HIV and AIDS, or treatments, steroids, chemotherapy, that suppress immunity, and liver disorders, and lastly, children and adolescents who are receiving long-term aspirin therapy.
I am Elsie Tagapan and I will discuss the clinical manifestations of influenza. The signs or objectives is cough, fatigue, vomiting, and diarrhea. For the symptoms or subjectives, there are fever or feeling feverish or chills, tickle in your throat, body aches, sudden fever, sore throat, runny or stuffy nose, muscle or body aches, and also headaches. For the pathophysiology of influenza, human influenza virus infection replicates primarily in the respiratory epithelium. Other cell types, including many immune cells, can be infected by the virus and will initiate viral protein production. The primary mechanism of influenza pathophysiology is a result of a lung inflammation and compromise caused by direct viral infection of the respiratory epithelium, combined with the effects of lung inflammation caused by immune responses to handle the spreading virus.
Next is management of influenza in medical. Usually, you'll need nothing more than rest and plenty of fluids to treat the flu. But if you have a severe infection or are at higher risk of complications, your doctor may prescribe an antiviral drug to treat the flu. These drugs can include oseltamivir, zanamivir, peramivir, or balozavir. These drugs may shorten your illness by a day or so and help prevent serious complications. So what does this oseltamivir, zanamivir means that can shorten the illness of the patient? Oseltamivir is an oral medication, while zanamivir is inhaled through a device similar to an asthma inhaler and shouldn't be used by anyone with certain chronic respiratory problems such as asthma and lung diseases. And the most circulating strains of influenza have become resistant to amantadine and rimantadine, or call it flomidine, which are older antiviral drugs that are no longer recommended. But if you want to calm down and help ease your symptoms, all you need to do is just drink plenty of waters or liquids, rest, and consider pain relievers. This is to help you control to spread the said influenza. Now, the surgical management of influenza is there is no surgical treatment for this disease or influenza. Only antiviral drugs can help you.
I'm Anjali Sihalbo and I'm discussing the midwifery role in influenza. Independent, promote and provide antenatal influenza vaccine and to provide a statistical and thematic description of the barriers. Midwives could be influential in promoting vaccination against influenza, especially to the pregnant woman. Midwives are also giving advices about influenza, and the vaccination. Midwives can educate, including the information addressing the safety and effectiveness of the vaccine. Midwives administer influenza vaccine to pregnant women since influenza infection is associated with higher maternal mortality and morbidity. Dependent role or the doctor's order. Your doctor will conduct a physical exam, look for signs and symptoms of influenza, and possibly order a test that detects influenza viruses. Your doctor may also suggest that you be tested by influenza. He or she may use various tests to diagnose influenza. During times when influenza is widespread, you may not need to be tested for influenza. Your doctor may diagnose you based on your signs and symptoms. Doctors will test PCR or polymerase chain reaction. So, this test may be done while you're in the doctor's office or on the hospital. Next is the collaborative or the referral. Refer immediately to doctor or current recommendations on the use of antiviral agents for treatment and chemoprophylaxis. If symptoms persist, refer it promptly to the doctors for urgent treatment to avoid affecting others and complications. If you are pregnant or up to 2 weeks postpartum and you have flu, your midwife must refer you to see a doctor because you are considered high risk, so you must see a doctor for prompt medication so that the doctor may prescribe an antiviral medication. So the earlier that the midwife refer you is the better.
The reference. Group 4 Renal disorder and common infections like Rubella and Influenza, prepared by Angeli Luis Cijalbo, Jovelyn Solito, Lovely Tolentino Subia, Eloisa Samalag, and Elsie Tagapan.